This last week, New Hampshire became the first state, according to Governor Chris Sununu, to reject federal funding to boost its COVID-19 vaccination rate. But that doesn't mean the money or this debate is going away. And frankly, it's just one of the many major issues being juggled by Health and Human Services Commissioner Lori Shibinette, who is our guest this morning on Close Up. Thank you for joining us, Commissioner.
Thank you for having me, Adam.
So there's a lot we can talk about regarding that executive council vote rejecting the $27 million in federal vaccine funding. But I want to start with what happens next. You indicated at the meeting you could try to bring this funding back in a way that might be able to gain council approval. How are you going to do that?
So, yeah, I think our first task is to really look at what we have available for funding, both state and federal funding in the coming week. I think the biggest concern is that even if we can identify a funding source, it's going to take several weeks. It has to go through the normal process, governor and council and fiscal. And what we do know is that we're expecting announcements around child vaccines for ages 5 to 11. We already have Pfizer booster. We're expecting other boosters to come out in the coming weeks. And I don't know that we're going to get through that process of governor and council and fiscal in a timely way. So what that does is it reduces the accessibility and makes it less convenient for people to seek out their vaccinations.
Some of these anti-vaccine mandate protesters have clearly fixated on you in a very negative way. You're an administrator, not a political figure, but you find yourself surrounded by this political situation in this moment, particularly given what happened at St. Anselm College 2 weeks ago. To what extent do you have to worry now about your own safety, and how does that impact being able to do your own job?
Well, you know, I'm a true believer that a foundational component of being the commissioner of Department of Health and Human Services and part of public health is to educate the public. The department can't be intimidated or pushed into making decisions one way or the other. We are truly nonpartisan. We serve to educate the public and meet the needs of our citizens. So we need to, in the face of that conflict and what happened at St. A's and what's been going on recently, we really need to put our head down, be focused on our mission, be focused on our goals, which is really to educate the public with credible sources of information.
Yeah, and you're willing to go toe-to-toe with anyone on misinformation regarding COVID-19 and the vaccines, as you showed before the fiscal committee last month. But you could fight that fight 24/7 and still not keep up with the fire hose of misinformation that is out there on social media right now. So what can you do when you provide people with the facts and they simply say, I don't believe you?
Right. And we've been hearing that a lot lately, right? I think one of the really important things that I would like to see in the future is a united voice from healthcare, right? When you have an absence of united voices that come from credible sources, it gives a stage to the outliers. You know, we've seen with the protests and with people that are protesting vaccination mandates, all of those things, you know, you will have an outlier of a nurse or a leader position that will say something that is not correct. But the true fact is that 88% of nurses in our country are vaccinated, 96% of physicians in our country are vaccinated. And we need those voices, those healthcare voices to unite and be the loudest voice to say, this is the real information. This is the credible information. It becomes extremely difficult to fight misinformation when we have people in leadership positions spreading that misinformation. It makes our job that much harder.
We look at the numbers right now, and clearly rural New Hampshire is getting hit the hardest. Sullivan and Coos counties seeing those numbers shoot up. You've got some communities up north with vaccination rates under 25%. And these aren't parts of the state that have big hospitals or a lot of healthcare capacity to begin with. So how does the state, how does your department step in and help?
So and we're focusing on those communities that have low vaccination rates and really trying to get the message out there and make sure that the vaccine is accessible through our vaccine ban and other programs. We stay in constant contact with our hospitals, but between myself and Dr. Ballard here at the department, we meet with the hospital partners every Tuesday and Thursday. And in addition to that, we have one-on-one conversations. I had talked yesterday about the fact that I spoke to the CEO of Androscoggin Valley Valley last week because I had heard that, they were having a real surge in COVID hospitalizations. And that constant contact is really important because we're learning what we need to do to back up our systems, right? We have a great network of hospitals in New Hampshire, and between the Tuesday and Thursday calls, and all of the work that we've done for the last 18 months, the hospitals are really sharing in that responsibility to make sure that the healthcare needs of everybody in the state is met. So what we're seeing is that our rural hospitals are able to transfer patients into our bigger hospitals if they become overloaded. And that's exactly how our system and our network should work. They're really helping each other out. But that constant communication, because what we do know about COVID is that on the ground, how COVID looks and what we're seeing changes every single day. You can have a hospital go from having a manageable census, and especially in rural areas, to getting 2 or 3 more patients that need comprehensive ICU beds, and that being an overload for a small rural hospital. So that constant communication is really important.
When we talk about hospital capacity, you've noted before the issue isn't beds, it's staffing. How close is the state to hitting a tipping point of not having the doctors and nurses necessary to respond not to just the pandemic, but the day-to-day needs of healthcare?
Well, I think it's not just the doctors and nurses. The doctors and nurses are the people that we talk most about, but it's not just them. It's the nursing assistants, it's the occupational therapists, physical therapists, and direct service providers for home and community-based care. I think that, we've seen a shortage of these types of healthcare workforce for a long time, and it's dramatically worse now, especially in the last couple of months. We've seen that those workforce numbers get worse. I think what we're experiencing is some of our healthcare systems, both hospitals, nursing homes for sure, they are changing their census so that they can maintain the high quality of care they give, but to a lesser number of people. And I think that you're already seeing that happen. Hospitals, nursing homes, home care agencies are flexing depending on their staffing numbers. I know some nursing homes have dropped their census by 10 or 20% because they don't have enough long-term care healthcare workforce, which is the nursing assistants and nurses, to be able to perform the high level of care. So I do believe that you're going to see this continue for a period of time. But the state is doing a variety of things between increasing the nursing school admission rates over at UNH. We did a lot of work around that. I just put out a request for proposal for a nationwide recruiting firm to recruit healthcare workforce for all providers in the state of New Hampshire. We know workforce is the limiting factor for everything we do at DHHS. So recruiting them for everyone is really where we're focusing on. We're really looking at it from a system point of view. So that RFP is gone out. We had a vendor conference last week. We expect to be awarding it near the end of the year, and really looking for a company that goes nationwide to sell why New Hampshire is a great place to live and work in healthcare. You mentioned nursing homes. Obviously, long-term care is your background. How concerned are you about another potential spike in mortality happening there, especially as we hit that point in time where they're going to need those booster shots in the weeks and months ahead? The boosters can't come quick enough. We're seeing an uptick for sure in nursing home cases, not the way we were seeing back in the spring and summer, but we are definitely seeing an uptick. So the sooner we can get those boosters completed, the better we will be. If there is a delay in the boosters, I would be very worried about that. But right now, I think we are on track to have the boosters implemented and administered within the next several weeks. A lot of people have also had issues with getting timely testing results and access to testing. You're opening new fixed sites to respond to that. But if vaccination is going to lag and we're going to limp along with a significant chunk of the population unvaccinated, doesn't the premium become land on really driving testing even more, that just 4 fixed sites added aren't enough, that you might need a little bit more than that? Yeah, I think that there's a lot of providers that do testing. This is the state COVID response, but all of our healthcare providers, a lot of our pharmacies are still all doing testing. A lot of our urgent care centers are still doing testing. So there are plenty of testing sites, but we do know that there is a shortage of the rapid tests right now. And when there's a shortage of rapid tests, people start to rely on the PCR tests. So we initially did the 4 sites. We will ramp that up if we need to ramp that up. As everything with COVID, and we've experienced this for the last 18 months, is we need to be nimble and flexible. And there are times where we're going to have to flex bigger, and there's times where we can shrink programs. And we make those decisions every single day.
As we noted earlier, there are several major issues you're dealing with. Obviously, the mental health ER boarding crisis is one you've been working on for a long time. The state just announced it's in the process of purchasing Hampstead Hospital, where a lot of the younger mental health patients are treated. How far do you expect that acquisition to go in really bringing down your ER boarding numbers?
Oh, I think it's going to be a major milestone for our state. When we learned that Hampstead was in a position where they would be looking to sell, we knew that we had to secure this vital resource for our state. So right now they're operating their hospital at about a census of 45, and they have the capacity to do 111. Now, do I think we're going to get right to 111? No, but I do think there is potential there to grow both capacity and specialized care, and that's what our plan is. We talk a lot about a center of excellence for children's behavioral health, and Hampstead has a great reputation, and we want to keep that going. So I do think that we're going to see not just increasing bed capacity in the coming year to 2 years, but we're also going to see more specialized care.
HHS Commissioner Lori Shibinette, thank you so much for joining us on Close Up this morning.
Thank you for having me.